People will be allowed to use the Lifeline of Mumbai, the local train, from the 15th of August if they have had 2 vaccinations and 14 days have passed since their second vaccination. It's a big decision for the city of Mumbai and for Maharashtra as well, and it was made by the Chief Minister of the state, Uddhav Thackeray, over the weekend. But it is also a very important policy decision from a wider lens. Will a double vaccine then be the precursor or the basic condition for allowing freer movement of people as we try and push back and avoid a third wave and hope that even if we have one, it will not be a very harmful one? It's a question to ponder as we continue to open up in fits and starts and in different phases around the country. So, for example, should you have double vaccinated people only allowed in malls, in restaurants, at shopping centers, in buses or other modes of public transport? Is that a good way to make sure that infections don't spread, or will it be discriminatory to those who either haven't managed to get their vaccine yet or simply don't want to? Yes, vaccine hesitancy is a big problem. Yes, it's something that which should be battled, but right now under the law, vaccinations are not mandatory. Should they be made, in a sense, mandatory by policies like this one? It's a debate we're having today on the show, and joining me are Dr. Shashank Joshi of the Maharashtra COVID-19 Task Force, Anurag Katriar, President of the National Restaurant Association of India, and Murali Neelakantan, Principal Lawyer at Amicus. Welcome to all of you, and thank you so much for speaking with us today. Dr. Joshi, even as the state of Maharashtra decides on how much to open up further, we've been conservative compared to other area states, especially the city of Mumbai. Even with lower infections, we haven't opened up much. But will the decision hinge on tools like vaccination, that if people are double vaccinated, they will be allowed to go into more areas and have, relatively more freedom to move about?
Tamanna, thank you so much. Yes, partly that is correct, because we are being a little slower, because if you saw, for the second wave, we are having a thick tail. And even now, as we talk, 5,000-6,000 patients per day are still reported in the state of Maharashtra. Mumbai still reports around 300 cases per day. So it is not that COVID is over, but to a great extent, it is not extinct. For example, if you just compare that with north of India, like Delhi, or there, other parts of North India, virtually it is non-existent there. The second wave, we can say and claim, has gone completely there. But, the main yardstick is globally, you will see that if freedom of movement has to be there, 2 vaccinations or 2 jabs will become order of the day, or some degree of exposure or immunity. Currently, immunity passports have not come as a part of the system, because we are all early generation. This is all early phases. Second thing is, independent of vaccination, we still need to mask and follow COVID appropriate behavior. But at some point of time, we can't be locked in all the time. So you are seeing that we are easing restrictions in a systematic way. First were the shops and establishments. Then are the indoor dining spaces are being looked at. The trains are being looked at. So gradually, one by one, each and everything which has been locked in has to be opened up. The 2 yardsticks for that is, one is, are we prepared with adequate healthcare infrastructure? Should a third wave come, do we have sufficient oxygen to give those patients? That is one extreme. The other extreme is, are the people adequately exposed or protected? So double vaccination is one of them, and equally important would be masking.
No, true, but let me come back to my basic question, Dr. Joshi, and which is the key question of this debate. Should double vaccination be made mandatory for access to certain places? Because by doing that, you're effectively making vaccination mandatory, even if it's not there in law, if you don't pass a rule about it. But if you allow only those with 2 vaccines to enter certain public places, you are effectively making it mandatory. Do you think that's the only way forward?
There is always a debate, because we are we have a lawyer on board here, and he'll be in a better position to answer that. But let me be very transparent here, that if we are in a public space where there is crowding and distancing is impossible, then we will have to have some caveat or some exception. And therefore, this is more of an exception than a rule, that in a train, you are expecting to be crowded. And therefore, because there is crowding, we want to try to minimize and mitigate some safety valve. So it is like an indirect safety valve beyond a mask, because we cannot mandate masking inside a train. We know there is zero distancing possible there, because there are three basic criteria, cardinal rules of COVID: mask, distance, and sanitization, of which distancing is impossible. So the fourth pillar is vaccine. And therefore, something is better than nothing. So I think, if one wants trains open, one wants economy to restart, there will be some checks and balances in place. And I feel that it is reasonable. Because see, what are we trying to do with the vaccine? We want no lives to be lost due to COVID and no one to get severe COVID. Vaccines to a great extent, for most of the people, most of the time save lives. And for most of the people, most of the time will also ensure severe disease is not there. So from that ethical standpoint, as a medical scientist, I can claim that yes, there is some scientific rationale in this.
Anurag Katriar, how do you look at it as a business decision? So, for example, if restaurants were to, and they would be well within their rights, I assume, to say that they will allow entry to patrons who have had 2 vaccines. Don't you think that would increase confidence for people to come back into restaurants, especially those which have indoor dining and not outdoor? So you're anyway in a place where, you have air-conditioned circulation of air, and then if you add this double vaccine filter, do you think it's doable? Is it something you would want to do?
So I think there is a huge difference between when you look at a train, which is a very crowded place, which cannot be regulated, versus a restaurant which is working at a 50% capacity. So the same rules don't apply. And I think if we have to go with a double vaccination rule for restaurants, it'll not be a great thing for the business, because the number of people who are vaccinated twice are very few and far in the country. Most of the people are waiting for 84 days to get their second jab, especially the ones with Covishield. So I don't see, but I can understand what Dr. Joshi is saying. A crowded place like train is where, the situation is a little, it is not a very contained environment vis-a-vis a restaurant. So yeah, to answer your question, I don't think double vaccination can become the norm for entering into a restaurant. And it's very different than a restaurant, because we are working within a contained environment with 50% capacity, enough distance between the people. People do take off their mask, but there is a physical distance between people. That's a huge difference.
Yeah. No, but 50% capacity is right now. The question is, going forward, assuming if there is double vaccination, perhaps the 50% capacity cap can be lifted.
Yeah, when a larger mass of people are double vaccinated, then absolutely fine. I have always maintained we are partners with the government in this fight. Every Indian is a partner in this fight against the pandemic. But we have to find a right balance between what is doable now and what is doable later. Tomorrow, if let's say 70% of the people in the city are double vaccinated, I wouldn't mind taking a line of thinking like that, as much as it could be a little harsh on the people who may be on a single vaccine. What happens to the kids below 18 who are not yet vaccinated? So there are several questions that need to be answered. It's still a little hypothetical. So I think looking at the current situation, I think a double vaccination is something that will not work for restaurants.
Okay, so this is a very real debate in many parts of the world, in the US, in Canada. There are groups who say that they have a right not to be vaccinated. Murali, how do you look at the situation as it's unfolding? It's not entirely hypothetical, because a large public transportation in a large city in India now has double vaccination as a criteria for using that service. So logically, it could be extended to other places as well. Should it or should it not?
I don't have a good answer to this. And sadly, the law doesn't give us many answers. And I'll say why. The restrictions on travel, on movement, on public assembly, all these are contained in Article 19. And public health is not a valid ground for restricting that right. Public order is, but public health is not. So we have that challenge here in trying to explain how it is that public health restrictions will be valid restrictions on the right to move, to assemble, all of that. Now, that then compares with Article 21, which is life and liberty. And clearly, public health is a good ground to preserve life and liberty of people. So at the moment, the question which we'll have to answer, if it ever comes up in court, is whether these restrictions are reasonable. So the questions that I expect will be asked is, why double vaccination? Why not one? The number of, what is the data to say that those who've had one vaccine are a threat to public at large, a public health threat? The second question that will be asked is there a less intrusive way of doing it? And there the question will be, why don't you allow those who've had immunity through infection to participate, because they're not a public health threat? And without classifying people in this manner, what do you do about children? What do you do about those who medically cannot take vaccines because perhaps it's contraindicated for them? Perhaps we don't know what the risk would be to them. So all of these questions need to be answered through procedure. And at the moment, there doesn't seem to be this kind of nuanced understanding of this issue in the policy. And courts, therefore, will look very carefully and say, this is too broad, this is too high of a restriction, and therefore the government needs to go and think about it more clearly. I don't see this as an immediate threat because the Indian judicial system is unlikely to grant any such orders, at least for the next couple of years, even if an application is made. So the government pretty much can do what it wants and get away with it, plainly because judges are going to be very reluctant to pass any orders. They haven't passed any orders on the vaccine policy, where there is a suo motu case pending. So I suspect that whatever the government does, irrespective of what the Constitution says, they might quite well get away with it.
Yeah, but the question is, I agree, Murali, that you're looking at it from the prism of courts and what happens if someone files litigation on such a matter. But broadly speaking, it comes down to a question of greater good versus personal liberty, doesn't it? That if there is someone who believes strongly that they shouldn't be vaccinated for whatever reason, children is a different category because the science is still not out there to see if it's safe for them. Once it is, a lot of children and their parents might choose to get them vaccinated. But it's about protecting the rights of those who don't want to get vaccinated versus greater good. Where would the argument then rest?
The argument would rest on all of these. In addition to procedure, which I have said, the argument is going to be on privacy, which is life and liberty again, and say, I must have the right to choose. Sadly for us, the Indian Supreme Court hasn't been very kind to those who are arguing this. It has not come down for life and liberty. So in the past, you've seen examples where the right to privacy has been hijacked on the grounds that the person has HIV, AIDS, and it is in public interest to disclose to his fiancée, to his family, that he has HIV, AIDS. Although scientifically that's exceptionally bad, but that's what the courts have held. Similarly, we've had notification for tuberculosis, where those who've been suffering from tuberculosis, the doctor who detects it or the hospital has to notify the government. And those people's data has been put out on Excel spreadsheets on government websites. So there has been a breach of privacy on the basis of public health, even though, as I said, public health is not a good enough reason to restrict Article 19, freedom of movement rights, but that's what the courts have done. So the law is perhaps on my side if I read it under the Constitution, but I suspect the government will get away with it. So it's no point saying we have rights if the court doesn't come around to protect it.
Yeah, the question that we're asking today is not only of rights, that's a big part of it, it is also about need. Dr. Joshi wanted to come in on that point.
So there are two things. Murali, I want to educate you that there is a current litigation in the Bombay High Court. And actually the Chief Justice and one bench, Honorable Chief Justice, they are looking into it very closely on the double vaccination and railways.
I know.
It is through that actually this whole process has started and government has taken a decision. Secondly, you make a very valid point that in public health, in public order are two different things. But this is a time of an unknown pandemic where lives are at threat and serious disease and healthcare infrastructure is at threat. And when lives are at threat, human lives are equally important. Public health is based on a basic principle of most of the people, most of the times. So then an individual right may have a compromise there in public health jurisprudence. And therefore, when a government is taking care of most of the people, most of the times, there will always be exceptions. For example, one such exception, the Mumbai High Court held up with the Honorable Chief Justice and another Justice of the High Court, was vaccination at home. And they passed a judgment where now vaccination at home for people who cannot do with a lot of caveats and riders put in is possible now. So there are exceptions, but exceptions cannot be rules. Let us understand one thing, that we are into a very unusual pandemic. A disruption of planet Earth did not occur. This happens maybe once in 100 years. There are lives at stake, and we have to take interest of lives of people versus the spread and threat of a spreading and super spreading event. And when there are too many unknowns, we have to have a tight balance. Vaccine probably allows us an opportunity to reduce that threat in some extent. I would not say completely also. So medicine is not a perfect science. It's not like mathematics. 2 plus 2 is not equal to 4. It could be 3 and 5. And which is why such debates are there. But I'm happy that these debates are there. My only request to everybody is that we must, if you are eligible, get vaccinated, because vaccines definitely save lives. That's my only humble request as a medical practitioner.
Could I just say, Dr. Joshi, that
Dr.
if you
Joshi,
agree not to speak about... could I just say this, that if Dr. Joshi agrees not to speak about
go ahead, Murali.
I promise not to speak about medicine.
Sure.
No, I think everyone should speak about everything. Why not? Let's all have an open discussion on all points. Look, COVID-19 has created really unusual situations where things like mutations and variants have become topics of discussions every day for everyone, whether they understand it or not. It's something that's impacted everyone's life. So in that spirit, Dr. Joshi, just to explain to us that if there are few unvaccinated people and more vaccinated people, then are those unvaccinated people still a threat to a larger group of vaccinated people? I'm asking this because this is a theory being floated, and this is something that people are using to propagate vaccine hesitancy. That if a large enough number of people in the room are vaccinated, then those few one odd unvaccinated people don't really cause any harm and have no harm to themselves. Is there any science to back this, or is it really not true at all?
So let me see, the people who are not vaccinated, they have a threat to their life. And for me, saving their life is far more important. And not doing anything when there is a solution available, I don't think is a practical solution. This is, as we talk right now, Tamanna, happening in United States. A large proportion of United States, 70% is vaccinated. But there is a particular geographic region of United States where a large population is unvaccinated. They are the ones who are filling up the hospitals. There is no oxygen in some states like Missouri and small other geographies there. And that is the big serious problem. So our first principle is we need to save every life. And if we have a solution to save that life, which is reasonable, which is safe, and within our domain, we should try to do that. And that is what the government is doing in its wisdom. And I think the courts are supporting it. So I think we have to balance. And Mr. Neelakantan, I will never, ever get into your domain. It's not a domain of my expertise at all. I know my domain. I apologize if you felt that I was transgressing your domain, but we have also understood how, individual rights can sometimes be, when it comes to a public health disaster, and when it comes to disaster management, and when it comes to lives at threat, in pandemic times, sometimes we might have to take decisions which may not necessarily be best in individual interests. And that is something which we need to be mindful of. That may not be fair and reasonable for that given individual, but it may be fair and reasonable for the community at large. Because if the community health is at threat and lives are at threat, then one needs to be cautious and careful.
I want to bring this. Murali, do you want to quickly respond to that, and then I can take my next question to Anurag?
I think the danger with this saves the majority versus sacrificing the majority is a very dangerous argument in the law. To say that we will look after 90% and therefore it will save 90% and therefore the 10% should just adjust is a very dangerous argument. The Constitution does not recognize this for a particular reason because rights under the Constitution are individual. It doesn't matter whether the group is better than the individual. The benefit of the group versus benefit of the individual is not a reasonable basis for restricting an individual's choice. So it's a big issue, I find, when jurisprudentially somebody starts arguing with me the benefit of the majority, then we are on a slippery slope. Then you will allow hacking, you will allow people to be interned, you will allow preventive detention. Everything has been on the basis of for the benefit of the country, the society. So that argument to me is a very dangerous slippery slope. Although I do accept, as I said, for public health reasons, we need to have restrictions.
But Murali, what exactly what skews the pitch? I understand where you're coming from, but what skews the pitch in this argument is because we've seen the devastation of COVID-19. We've seen what happened when people didn't wear masks. By that token, even masks need not have been made mandatory, and that's what's happening in the United States right now. People are fighting for their right to not wear masks and possibly infect other people who could be vulnerable and die. I just want to get Anurag into this conversation from a private enterprise point of view. Anurag, now I know hotel associations, restaurant associations are ensuring that their staff is completely vaccinated, isn't it? Now, when I take the same argument, I asked you before about patrons coming in, people who are, paying customers to your restaurant coming in, and for obvious reasons, you might not want to restrict that pool of people by putting in a filter of 2 vaccinations or 1 vaccinations or anything like that. But when it comes to people working in your restaurant or in the industry, you will insist that they're vaccinated, isn't it? The same theory
100%.
holds there as well.
No, 100%. I believe as a business enterprise, it's my responsibility to ensure public health. And I'm very, very clear. In fact, I don't know if you're aware, NRAI is conducting free vaccination camp for restaurant employees across the country. We have already done about 20,000 odd vaccinations, and this is going to continue. See, I look at it, I'm neither a lawyer nor a medical expert. I look at it very simply as this. We keep talking about our rights as citizens. I think along with that, there is also our responsibilities as citizens, and wearing a mask or getting vaccinated is part of that responsibility under the current circumstances. I don't want to get into the legal debate of it because I don't understand the subject, but I'm very, very clear that the people who are working in my restaurants have to be vaccinated. Otherwise, they're a threat to my guests, and I don't want to take that risk. I think it's very unfair on me to do that. So I'm absolutely clear that people working in the restaurants have to be vaccinated. And if they don't want to get vaccinated, they better look for some other job.
Yeah, so right to employment also comes into the picture. This is going to be a tricky terrain. This is going to be a slippery slope. And yeah, at some points, the greater good is going to outweigh. I think we haven't heard the end of this debate, but I want to thank all of you for joining us and raising some of these very important questions, which is going to be the reality of our time going forward. I think it's inescapable now to think about, not being vaccinated or double vaccinated. If you want to travel somewhere, book a hotel. And yes, if you're in Mumbai, even travel on the local train. So it's a reality of our times. We'll have to see how this story unfolds. Thank you so much to all of you for joining us this evening.
Thank you.
Thank you.